I'm Alicia DeLashmutt. I'm Neva's Sin 6 mom. Neva has some complex health and support needs in schools and in community. And we started advocating almost immediately, it feels like. When Neva started out in early Head Start and then into Head Start, we wanted to make sure that she was with her peers, doing typical things with peers, exposed to the same things they were. And we realized very quickly that most teachers hadn't been exposed to a child with as complex a need as mine. I was working at the time. I ended up leaving my job to become full-time mom and advocate because of this. I knew that she needed to be included in her world, so that starting from the very early days, so that when I was dead and gone, she would still be included in her world when she was an adult. We've worked really hard to make sure that teachers understand the importance of having children all learn together, having children play, having children talk and eat and get dirty and run around all together. When we were getting ready to move from early childhood education into kindergarten, it was important for me to meet the team that was going to be working with my child. So I called for a sort of getting to know you meeting. You know, who are these people? How do we get to know each other? How can I explain my child in layman's terms versus you know, what's wrong with her, what she needs? I just wanted them to know who she is, who we are, and that we are the type of family that is very open and willing to collaborate and work together and brainstorm. Again, I know that oftentimes teachers have not had a child like mine in the classroom. Kids like mine usually get sent down the hall to a room with a closed door, and I did not want that for my child. So anything that I could do to help the team, help the teachers, include her, that was our goal. We met with the IEP team early. We got to know them. We expressed our views. We asked for the IEP early so that we could review it. We gave some goal possibilities, some suggestions, gave a very thorough present levels. Our team saw her in a couple settings for maybe 15 minutes total, which is really, really difficult to get the big picture idea of a kid that quickly. So as mom, I wanted to make sure that they knew what we knew about our child in the IEP. I also wanted to learn as much as I could about all the different sections and what input I could have in all of those different sections, and how it all comes together, that you have your present levels, you have your goals, you have your supports, and then you have your placement. It's not backwards. It's very, you know, it has one thing that follows after another. And of course, as a parent, we sort of reverse engineered it, thinking, well, where do we want our child educated? How do we want her educated? And how does this whole document then support that, that type of education?